Webinars ready to go. And tonight we have a very special guest. Many of you know my partner, Woody Turner. Well, Woody's wife is a Medicare expert, and she's going to lend her expertise for us tonight. Answer all of your questions. This will be an interactive webinar. So as you have your questions, just go ahead and put those in the chat, and then I'm going to be monitoring while Gay is going to be going ahead and giving out the information. So and at the end, of course, we're going to have more time for questions as well. If you forget a question or have a question later, feel free to reach out to your advisor. That advisor will get you in contact with Gay Turner, and she'll be able to get all your questions answered for you. It is tricky. There's a lot of moving parts, a lot of changes that happen when it comes to Medicare. So want to make sure that you get all the information that you need. So with nothing else and without any further delays, Gay Turner, I'm going to turn this over to you.
Beautiful, beautiful. Thank you. Hi, John Harrell from Georgia. We've spoken, but I've never met you before. So hi, Ned. And thanks, Adam. This is so great, and I'm glad that everybody tuned in to do this. The slide presentation really, or PowerPoint, is really not very long, um, on purpose because most of these slides generate a lot of questions. So I try to leave several minutes or whatever open so that everyone can jump in and ask their questions. And Adam's going to be fielding those. So we're going to get started. Medicare 101. There is myself and my daughter-in-law. As you can read, have been in the industry since 1997, probably the past 15 to 17 years, really heavy focus on Medicare, which has become such a passion for me. And then just this past July, our daughter-in-law, married to our youngest son, joined the practice. So I'm super excited to have her. She had planned to sit in on the webinar tonight, but they have a teething 9-month-old, and she only wants mama. So I gave her a hall pass for tonight. Okay, jumping right in to original Medicare, and I'm sure that you have all heard this and seen the red, white, and blue cards. So the Part A covers hospitalization. Doesn't cover, it covers other things other than hospitalization, but by and large, on your card, that's what it's going to say. Part A, hospital. Part B, doctor and doctor services. Part A does come with an annual deductible of $1,676. Then Medicare, 80%, you 20%. Bear in mind too, these are 2025 numbers. The 2026 numbers were just finalized and announced, so I'll speak to that in a second. Part B, and Part A does have zero premium as long as you have worked 40 quarters in your lifetime and you're a US citizen. Part B does come with a premium, and so you do have to physically sign up for Part B. The premium for that is $185. Annual deductible $257, not horrible, but then 80 to Medicare, 20% to you. The 185 does have an asterisk because that is the base amount. There is a potential for those who have higher incomes will be assessed an income-related monthly adjustment amount, which is lovingly known as IRMA. But most people don't really like IRMA because that means that you're going to be paying more per month. And there's the Medicare card. After you have received your Medicare card, that's when we get busy. We can't really do anything until your Medicare card is in hand. And even though the Part A and Part B may not be active yet, it will be active within a matter of weeks if you've already got it in hand. And normally that's when we start getting the calls. If we get calls before then that folks say, I don't know how to apply, and I know some of Woody's and Adam's clients have kind of deer in the headlights, like I don't even know where to start, we will help direct you how to apply for Part B. And normally what I'll do is just I'll have my computer up, they'll have their computer up, and then I'll walk them through it. I can only get to a certain point though before I would actually have to apply. And I'm just not there yet. So I will walk them through and try to make it as smooth as possible. Again, after this is received, um, we can go forward with what would work best, whether that is a Medicare supplement or a Medicare Advantage, but we'll talk about that on the next screen. Um, Enrollment and deferral. We hear the questions quite often. I'm still working. I don't plan to retire right away. Or, do I have to sign up? Everybody says I'm going to be assessed a penalty and all that. So here's the deal. You can address that with your clients and let them know that if you are covered under an employer plan, either your own or your spouse's, you are protected. You do not have to apply for Part B. Also, if you're covered under TRICARE. Um, so if you're those three scenarios, you're good. You're protected. Um, During the time that you are in your window, and I call it the Medicare sandwich. So that's 3 months before you turn 65, the month that you turn 65, and then up to 3 months after that. So that's your sandwich. That's your 7 month window that you can apply for Part B. And then I can get you started on what comes after. There is a late enrollment penalty for those, and we have had a couple of folks that have said, well, I just didn't want to have to pay that Part B premium, so I just didn't sign up. And now, I don't know if they were advised or ill-advised or not advised at all, but now they are having to pay part of that Part B um, penalty, which is up to 10% per year. And that, unfortunately, folks, doesn't stop when you apply. It stays with you forever. So, not a great idea to listen to someone who doesn't really know the ins and outs of Medicare. So, Social Security versus Medicare, we get the questions quite honestly where those are interchangeable terms and they are not. So I asked Fran to put a slide in here that just outlines Social Security is actually cash money that you will get, cash benefit that is paid to you monthly now that was deducted from payroll during your working years. Not to be confused with Medicare because Medicare are the health benefits that you get, that you are qualified to and eligible to receive once you turn 65, or for those under 65 that have disabilities and that may have been on long-term disability for 24 months. So the two are not interchangeable. One is money, one is healthcare. Okay, after you get that red, white, and blue card, and we meet and we start discussing what comes next. Um, it is common for folks to use supplement as just that catch-all term for what is used to supplement your Medicare, but it is actually two different things. There is supplement, which works directly with original Medicare. Of course, as we saw on one of the first slides, Part A is hospitalization, Part B is your doctors, and it comes with a deductible, annual deductible, and then 20% would fall on you. That's and again, the deductibles are not what's going to, put you in a bad situation if you have a really large medical bill. It's that 20%. So 20%, and you can do the math of $1 million if that's how much your hospital bill was, can put you in the wrong position in a financial situation. So folks that feel as though they want to stay with original Medicare may choose an actual supplement that is they're standardized plans. They're lettered A through N. Right now, G is the richest, and that would be the most comprehensive available. during your initial election period. Medicare supplements are guarantee issue, which is great, meaning you don't have to answer any medical questions. Outside of your initial election period, that's what IEP stands for. They are medically underwritten. Now, if you can answer no to the medical questions, then no problem. It will be issued to you. But typically, people get into the supplements right when they turn 65 and turn on their Medicare. They sign up for Medicare. They will go on to the supplements. The advantages to being with the supplement that it is the ultimate flexibility. As long as your physician or facility takes original Medicare, they will take your supplement. There's no networks, so you don't have to worry, is my doctor in or is he going to drop out? You don't have to have a referral. Typically, folks that have travel a lot or have a home in more than one state in the United States find this to be the best option for them. However, it does not include Part D, which is your prescription drug plan. So we would need to address that. Supplements with the little asterisk does work in conjunction with original Medicare, but it does not include vision, dental, or hearing. Any questions so far that you want to toss out to Adam?
Actually,
Feel free.
we did have one. It came in, it said, I think you covered it, but just to be clear, are there any late enrollment penalties for Medicare Part B? I believe that was the 10% for life penalty.
10% per, up to 10% per year. Yeah, which comes out to be like 1.8 something something per month for every month that you are outside of the window and you didn't sign up.
Ah, okay. For a maximum of 10% then?
For a maximum of 10% per year.
Understood. And the follow-up to that question was, is there a delay then in that coverage?
You're gonna have to expound on that. I'm not sure I know.
So I'm as I'm reading it, I'm understanding it that I know now that I've signed up late. Now that there's a penalty, is there a further penalty where now I have to wait, say, 90 days or 6 months?
No,
Okay.
no. Mm-mm. That is a
Um,
good question. I haven't heard it posed that way, but no, no. It's just that now instead of on top of your 185 per month, you're going to have 185 plus whatever your penalty was
Understood. And then is there a maximum out of pocket
for what?
for, say, I'm assuming like a medical event?
No. So if we're still talking about supplements,
Mhm.
you are going to pay the premium that's associated with the letter plan that you get. And as I mentioned, G is the most comprehensive, so it also comes with the heftiest premium. So you are going to when you go to see a doctor, let's just say a doctor and not a hospital, you're going to hand that red, white, and blue card, and you're going to hand your supplement card depending on what carrier it comes from. It can be A to Z, Aetna, Blue Cross and Blue Shield, Cigna, all the way down to United. It could be any of those carriers that offer Medicare supplements. Medicare is going to pay what they're going to pay. Your supplement picks up the balance once you've satisfied any deductible. So max out of pocket, Adam, would be really in this situation picked up by your supplement as long as you've satisfied your deductible. And I think it bears circling back to that if you choose Plan G, Plan G will pick up your Part A deductible, which is $1,676, and the 20%. It will only pick up the 20% of Part B. As of, there's an acronym called MACRA, MACRA, and what that says is that Medicare will no longer allow the carriers for the supplements to pick up the Part B deductible. Now, anyone that qualified for Plan F that turned 65 prior to January 1st, 2020, they can have their Part B picked up. So they will hand their red, white, and blue card and their Plan F card, and they walk out. They don't pay anything else. The Plan G I like to refer to as the little sister of Plan F. And so it acts exactly like Plan F, except for you are responsible for the Part B deductible, which is, you know, right now it is $257 for 2025.
Got it. Yeah, I think there's just so much confusion with standard healthcare that we're getting with our jobs, and then this whole transition to a whole new thing. So thank you for
Hmm.
clarification. I
Hmm.
have a couple more questions, but we'll continue and then we'll get to those in a minute.
You got it. You got it. Okay, so at the fork in the road, when you've gotten your red, white, and blue card, and now you're faced with what do I do? You can go one way with a supplement and a prescription drug plan, or you can take the Medicare Advantage plan. You cannot do both. It's illegal for me to sell it, and it's illegal for you to have it. So it is a literal decision that you need to make. Medicare Advantage plan is a managed care. They come in the form of an HMO or a PPO. Some people say, well, which is best? What's best? So in the interest of supplements and Medicare Advantage, by law, Medicare Advantage plans must cover at least as much as original Medicare. Typically, they cover more in the adding of vision, dental, hearing, fitness, on occasions, over-the-counter drug essentials. So I people should not be frightened of a Medicare Advantage plan, but the major differences is that you must stay within a network. It's commonly called Part C, and it includes your Part A hospital, Part B doctors, and Part D, which is your prescription drug. So you have to have your Part A and Part B active in order to get a Medicare Advantage plan. But if you choose that that's the right route for you, you'll really put your red, white, and blue card away in a safe spot because the Medicare Advantage is going to be used for your prescriptions, for your at the doctor, at the hospital. It's that card that you're going to use. You won't use your red, white, and blue card any longer. It used to be referred to, the Medicare Advantage plans used to be referred to as Medicare replacement. And that verbiage had to be reframed because folks thought, oh, well, if it's a replacement, I don't have to pay for my Part B anymore. And that's untrue. You must always keep that Part B. Once it's active, you must keep it active. Typically, those premiums come drafted right out of your Social Security check. If you did not turn on or you're delaying turning on your Social Security, then they'll bill you quarterly in the beginning. We learned with Woody, he we thought it was going to be quarterly, just like it's always been. But after that first quarter, they did allow him to pay monthly, I believe it is. So monthly premium with Medicare Advantage plans in our area. And when I say our area, I mean Florida, most certainly the Hillsborough, Pasco, Pinellas, Polk areas are zero premium. They do have copays. You do have to stay within a network. You do have to have referrals from with an HMO from your primary care physician to a specialist. With PPOs, you do not. The main differences between an HMO and a PPO are HMOs, you have in-network benefits only, meaning that if you choose to see a physician that does not have a contract with your health plan, your services won't be covered. So it is more restrictive, but they do reward people that are with an HMO. You have lower copays, lower max out of pocket, and often higher allotments for vision and dental. So some folks say, I go to my primary care physician for everything, so I'm okay with that. Other people that opt for the PPO like the idea that they have no premium, but they also like the fact that they can go in network and pay lower copays. But if they have a physician that they want to see that is outside of the network, as long as the physician agrees to the out of network billing, then they can see a physician outside of the network. So it gives you in-network and out-of-network benefits, but you do pay higher copays and higher max out-of-pocket in order to utilize um, that type of plan. They all, most of them include prescription drug plan. There are some Medicare Advantage plans, which are called MA only plans. Those are typically in conjunction with folks that have VA or they've got another prescription benefit, so they just don't need another one. So they'll just have the um, strictly the MA, the Medicare Advantage plan that does not have the prescription drug. I don't sell as many of those because it doesn't hurt you to have that, although some folks that are on the VA just prefer it. As I mentioned, most all of them now have vision, dental, and hearing, and they are area specific, meaning that if you live in Tampa or if you live in Hillsborough County, we're going to want to write a plan that is situs for Hillsborough County. Doesn't mean you can't ever leave the county, that you have a chain. That's not it at all, but the plans are area specific. So I would write the plan according to where you live. So any questions so far on that?
Yeah,
Because between the
per
supplement, go ahead.
perfect segue and break time there. So as far as the drug coverage, Gay, is it if there was a question that I had earlier where a client was saying that they didn't know if their specialty cancer drugs were going to be covered as part of Medicare D, and if it would be like an additional extra premium or anything like that. My
That's
advice,
awesome question.
yeah,
Awesome
my advice was
question.
that I would get that question answered by you.
Yeah, awesome question. So in the event of chemotherapy, those drugs are covered under Part B of original Medicare. Now, any anti-nausea drugs or any prescriptions that might be prescribed by the oncologist to help make some of your symptoms a little more bearable, those will fall under the prescription drug plan. But chemotherapy falls under B, Part B.
Okay, terrific. And then if we did a area specific plan, and then like many of our clients maybe have a second property somewhere, does that restrict them from getting general care, or is it just specific to that particular doctor?
So another super great question. And we do have clients that have their primary residences in Tampa, and then they have a secondary home. One happens to be in Colorado. Another couple of clients they have homes in Georgia and Tennessee. I really recommend strongly that if they really want the Medicare Advantage plan, to put them on a PPO that has a nationwide network, meaning that it would be a reciprocal network. So if they found a physician that in the other state outside of Florida that took that carrier, it's as though they're right here in Florida.
Perfect. And then what's most common? Is it taking the Advantage plan, or would it be just using the standard red, white, and blue plan?
So it kind of flip-flops every year. Um, the supplements, the price that you pay or the premium that you pay is associated with the age you are, because Florida is an issue age state, typically 65. So any increases that the carriers will have every year will be based on that 65-year-old male or female, tobacco or non-tobacco in the area you're in. Um, but that goes up every year. And I've had people that were diehard supplement folks, and they just got to a point where they said, I just can't keep affording the increases. So they would come over to the Advantage plan. So I can't say that there's one demographic that chooses the supplement over the Advantage. It just really is what works for you.
So it sounds like it's an idea where maybe once a year reach out to Gay and find out what's the best solution for them.
As a matter of fact, right now, yesterday started open enrollment. It's a 7-week hair on fire period, October 15th through December 7th, that I physically reach out to everybody on our list, every single person that is in our database. And now I have Fran to help me, so that's kind of nice. It's the first year I've ever had someone else to help me contact all the folks, but we literally contact everyone and find out if their health has changed, if their doctors have changed, if they're moving, if we find out what has happened in the past year and how can we best serve them so that the year coming up is going to work for them. And that could change year to year. I would say that the folks that are on the Medicare supplements, by and large, they once they're on it, they stay on it as long as they can until if they just can't afford the premiums anymore, then that's a different situation. And I have had folks before too that had plenty of wherewithal to continue to manage with their Medicare supplements, and they just decided they didn't want to do it anymore. And there is a caveat that if you start off on a Medicare supplement and you decide for that you would like to try a Medicare Advantage plan for 1 year, for 12 months, you can get off of Medicare supplement, get onto a Medicare Advantage plan, maybe just save the premiums, kick the tires, as I like to say, just see how you like it. And if you do not like that setup, you can come back to the Medicare supplement. You will not have to answer medical questions, but you will be charged the premium um, that of the age you are then. So in all actuality, a year older. So we would charge you. Now, someone could be 70 years old and say, I'm going to hop off of this for a year. And so then they're 71, but then, they may have come in when they were 65. So that rate change could be significant. But they can do it if they come back in within a year and their guarantee issue, regardless of what their health history looks like or what happened in that last year.
Okay, that's pretty important. I appreciate those who are texting me the questions, but there's also a chat box that you can use. That's right on the bottom of your screen there. So I'll answer them either way. But I thought that was funny. I'm getting questions. My phone's dinging over here too. So, Gay, thank you very much. You may proceed, please. Thank you.
Yep, you got it. Okay, this just is a side by side that shows the difference with the check marks with no networks and no referrals on the Medicare supplement side, and where on the other side, in exchange for having a zero premium, um, it's pay me now or pay me later. So either pay on the Medicare supplement monthly. For when you need it, or on the Medicare Advantage side, you have no premium, but you pay for copays when you use it. So that's kind of just the side-by-side comparison. Okay, prescription drug plans. 3 stages, and as of 2025, CMS, which is the Centers for Medicaid and Medicare, they were finally successful at getting rid of the donut hole, which is they've been trying to do for years, and they finally did it. So it went from 4 stages to 3 stages to the annual deductible. If your plan has one, members are required to meet this amount annually prior to copays. Some Medicare Advantage plans are able to buy down that annual prescription deductible. This year for 2025, it is, now I'm blending over everything in between 2025 and 2026 because now the 2026 stuff is out. I believe it's 585 is the annual prescription deductible for 2025. And then typically tiers 1 and tiers 2, like your generics, you do not have to satisfy that deductible, but any prescriptions that fall into usually tiers 3, 4, or 5, your Eliquis, those types of prescriptions typically do fall into tier 3, which you would have to satisfy the deductible before you get to pay the tier price associated with that tier. Once you've paid a combined total of $2,000, and that's for 2025, which includes the amount paid towards paid toward the deductible and your co-payments, then you'll move into the catastrophic phase. And once you're in the catastrophic phase, you won't pay anything else for the remainder of the calendar year. So that was part of the Inflation Reduction Act that was implemented for 2025, was that carriers now are responsible for any prescription drugs after you've met $2,000, which is great for folks that are on very expensive prescriptions. Not so great for the health insurance carriers that now have to shoulder that burden of anything over $2,000. I do now have, and I can actually speak to it now because it has been put out now by CMS, that the annual amount for the maximum out of pocket is going to be $2,100 for 2026. Okay, more on the Inflation Reduction Act. As of 2025, as I just mentioned about the donut hole, it was eliminated and instead instituted the max out of pocket of $2,000, 2,100 for 2026. In addition to that $2,000 cap, CMS instituted the Medicare Prescription Payment Plan, which they call MP3. And what that does is, if folks take a lot of medications, and I see this a lot, January, everything resets. Everything is calendar year in Medicare. So January 1st to December 31st. And so folks that are on some of those high priced drugs, now they're having to come out of pocket quite a bit in January. Medicare is trying to make it easier. And so there's a program that you must opt into through the carrier. And what they'll do is they'll take all of your prescriptions, even the ones that would be free or no copay, like those tier one and tier two, but they take all of your prescriptions and they'll divide it into 12 equal payments till you hit $2,000 for this year. So you're paying the exact same amount all through the year, which makes it a little bit easier for some folks on a limited income to be able to budget to pay for their prescriptions. Now, obviously, that will change if more prescriptions are added or whatnot, but that program has been a lifesaver to, again, those that are on really expensive prescriptions. The folks that are on tier one or tier two prescriptions, that is not a big deal breaker for them, as you can imagine. I covered kind of a lot there. Anybody weigh in on that, Adam?
Yeah, one question that came up was, are there any non-covered services? I mean, when we're talking about some procedures that could probably get pretty pricey, but is there anything that's not covered or would be responsible for the
Um,
participant?
Cosmetic, things that are not Medicare allowable. So, Medicare doesn't take kindly to, you know, anything cosmetic. Not saying that, folks that have eyelid surgery or whatever, I think it's called eye hood surgery or something like that, that it's impeding, that extra skin is impeding their eyesight. That is covered. Um, and just a cherry on top is that, some folks feel like it improves their aesthetic quality, but it is covered by Medicare because it is a medical service. But yeah, for the most part, Adam, uh, anything that's cosmetic, no. Anything experimental, they get a little iffy about also. But by and large, if it's a medically necessary um, procedure, then it's covered.
That's terrific news. You may be covering this in a future slide, but what is Medigap?
So, I'm going to go back because it's not your turn yet. Medigap is another name for the Medicare supplement because the supplement picks up that gap, which is the 20%, and that the Medicare does not pick up. So Medigap and Medicare supplement, one and the same.
Got it. And I know this answer to this question, but we'll throw it out there anyway. Is long-term care coverage part of this?
Not part of Medicare.
Yeah, that's a sad thing. I know, I think they cover what, the first 90 days, and after that, you're on your own?
Well, the first 20 days in a skilled nursing facility is one amount, and then days 21 through 100 is another amount. But after that 100 days, families have to make some tough decisions, and whether that involves working with an elder care attorney to maybe do a spend down situation where they could qualify for Medicaid, but anything over that 100 days becomes, you know, on the family.
Yeah, that's one thing. If it's in the budget and you're young enough to get it and healthy enough, it's definitely something you want to look into
That's
earlier
right.
than later. That's for
That's
sure.
right. That's right. That's right. I do want to throw out too, because I didn't cover that, and it when I had Fran update these slides, it wasn't um, Medicare had not finalized it yet, but the Part B premium for 2026 is going to go to 206.50. Currently, it's 185. So it was, quite a jump. And so that is the base amount that you will pay for Part B premium starting in 2026. So any IRMA, which is that income related adjustment, would be tacked on top of that 206.50. So it's it's creeping up there. The deductible, the Part B deductible, which again is at the beginning of the year. So in January, when you go to the doctor or you have a medical service, for 2025, you're going to satisfy $257 of that if you are on original Medicare with a supplement. That 257 is going to 288 for 2026. Again, those figures, the Part B premium, of course, will impact everyone, but that Part B deductible, if you chose a Medicare Advantage, that really will not impact you at all because you will now pay the copays associated with your services under the Medicare Advantage plan. That really comes into play only if you stuck with original Medicare and then you augmented that with the Medigap / Medicare supplement plan.
Got it. Yeah, and Gay, I mean, I know it's a complicated, and every situation is different, but can you get into Irma just a little bit deeper? I know for us, we've seen it, we've experienced it, and we know what happens when those types of situations come into play. Last few years, you want to amp up your, earnings, that way you get a higher pension, and then next thing you know, you've got this Irma issue that you have to deal with.
Yeah, and it's like a shell game, isn't it?
Hmm.
So an IRMA is a sliding scale that Social Security has put together, and that changes every year as well. So that sliding scale for 2026 will change. And so it's based on your income, whether you're single or married filing jointly, and it's based on the amount from 2 years ago. So if you're turning 65 in 2025, they're going to look at your tax return, and it's modified adjusted gross income, MAGI, MAGI, for 2 years ago. So on your 2023 tax return. And then, so conversely, if you had a windfall in 2023 that caused you to have to pay an IRMA for 2025, that could number one, you could ask for an exemption if you can show proof that that was a one-time deal. You're not going to be having that windfall every year, that it's going to impact your income and that your income is really going to stay the same. It's a process, but I have heard that they will honor that, they being Social Security. Um, but also, if you had dividends paid, or if you cashed in you know, some stocks or whatever, and you took that as a gain 2 years ago, so it would show up for, your IRMA for 2025, that will age off now in 2026, because bear in mind, you're going to now look 2 years back and you're going to be looking at that 2024 tax return. So, every year that you go on, you potentially, any increase could age off, which could potentially bring your income, your modified adjusted gross income down. And then if you did owe an IRMA, maybe you won't owe an IRMA for next year. And trust me when I tell you, they keep track of it and they will let you know with plenty of paperwork that you owe.
It's got to be quite the profit center. Is that this question for myself? I tr honestly don't know. Is it based off of earned income or is it any income sources whatsoever?
It's that modified adjusted gross income.
Okay.
And I learned a long time ago to really stay in my lane with this. I am not the tax girl, so I would definitely say for you to reach out to your tax preparer, um, and have them assess it for you.
Yeah, where I'm thinking this may
I
be an
really don't
issue.
know what all goes into the modifications for that adjusted gross income.
Got it. Yeah, I'm going to dig in a little bit deeper on that because I was thinking of cases where, if somebody has an inheritance and it's an IRA and now you've got additional income, is that going to blow up your Medicare premiums as well? So that's something to stay tuned to. I will find that out and get back to you.
Yeah, and it's my experience that if you're now on an annuity that is spinning off income for you, um, I think that might be your answer, but I would definitely talk to someone who does taxes because I will help you to understand all of that as far as, how much you're gonna owe, and only because, I look at the sliding scale and help to prepare them. We have been taught that we should not even try to calculate it. We can ballpark it, but they really insist that Medicare and Social Security do the heavy lifting on that. So all I can do is say, oh, it looks like this is going to be your IRMA, but wait to hear from Social Security because they'll be the ones reaching out.
Got it. I think bottom line is it's a complicated situation. There's a lot of moving parts. Clearly, things change year by year. So if you don't have a professional on your side, we got one for you. So, Gay Turner, thank you so much for everything today and for all the information that you've provided. Your contact information, is it on another slide where they can?
Um, there
There
we
we
are.
see,
Yes,
what a good segue.
there
So,
we are. Yes.
so if you're going to watch this as it's a recording, obviously, just go to the end. Otherwise, feel free to reach out to any of your advisors at Trinity Wealth Management, and we would be happy to get you in touch with Gay and also Fran. So thank you so much again, Gay. This has been great. I really
Well, thanks
appreciate
for
it.
having me, Adam. I appreciate it, and it was a joy. I really enjoy it, and keep those folks coming my way. I enjoy every one of them.
Well, we get nothing but rave reviews for the people that do talk to you. So again, thank you for everything that you do for us as advisors and for our clients. Have an awesome night, and we look forward to sending the more people your way that have these questions.
Thank you.
Thanks,
Bye.
Jay. Bye, everybody.